Good afternoon, ladies and gentlemen. And thank you, Tulsi Ji, for that very kind introduction. It's a very great pleasure for Neelam and I to be with you at Aravind for a week. And we're going on to Pondicherry at the weekend to look at Aravind's work in Pondicherry and then to Chennai. I have known of Aravind and about Aravind for many years, including having dinner with Dr. V and Tulsi Ji many years ago in San Francisco. But this is the first time that I've actually visited to see your work at first hand. And before I came, I was impressed from what I'd heard and what I'd read. But now I've seen what you do at first hand and walked around and talked to you and seen the work for myself. I'm extremely impressed. And I want to just congratulate you on the extraordinary achievements of Aravind. It's quite remarkable. Now I know you're at the end of a busy day, in the middle of a busy week. So I will try and be fairly brief. I will also try and entertain you a little bit and maybe try to provoke you a little bit. And I hope you will comment and ask questions and challenge me when we come to the discussion time. I've been asked to say a few words about myself, which I do reluctantly, but I will talk a little bit about me. And then I want to talk more about us rather than me. And by us, I mean our species, Homo sapiens. But let me start with a few remarks which may be of interest about me and my career. And I'm going to start those remarks by going back to 1897, which was not my date of birth. But 1897 was the year in which Ronald Ross and his colleagues working in Secunderabad discovered that Anopheles mosquitoes transmitted malaria. And in 1902, he received the Nobel Prize, the first Nobel Prize in medicine, the first Nobel Prize to an Englishman for anything, and the first Nobel Prize to somebody born in India for anything, because Ronald Ross not only worked in India, but actually was born in India. And I mention all that because on April the 1st, 1976, I joined the Ross Institute, which was an institute in the London School of Hygiene and Tropical Medicine. And I had previously worked on development projects in the Solomon Islands and in Papua New Guinea. Joining the Ross Institute in 1976 was really the start of my career in what we then called tropical medicine, and then later on we called it international health, and today we call it global health. And it's been a remarkable journey. I have worked in Asia, including quite a bit in India, and in Africa, and in Melanesia, and other places. And unlike, I think, many of my colleagues in global health, I have moved around in terms of the subject of my research and the subject of my focus. I started off working on the health impact of water and sanitation, a big topic in India today, with the big drive by Prime Minister Modi to end the practice of open defecation, which we used to call promiscuous defecation. I worked on that for many years. I worked on pediatric diarrhea. I worked on cholera, including cholera in Bengal and Bangladesh. I've worked on HIV and TB and malaria. And with my wife, Neelam, I've worked on health policy and health finance, and also on the role of the private sector in healthcare provision in developing countries. And I recommend that idea to you of moving around in your subject area of focus. And in doing so, I've learned a number of things, but I'm going to mention 4 of them quickly. The first thing I've learned is that combining a micro understanding with a macro understanding is incredibly useful. So whatever you're working on, I recommend having detailed knowledge of the subject matter, in your case, eye disease, but also having macro understanding and macro knowledge. How does eye disease fit in to the general health pattern in the community? How does what you do in your specialty fit into the larger questions about health in Tamil Nadu, health in India, and the delivery of healthcare services? So that combination of a micro view and a macro view, I have found extremely useful. The second lesson I've learned over the years is get the numbers straight. The numbers really matter. Epidemiology is the base discipline for everyone in the health sector. We need to count things, we need to count them accurately. I was just looking at data from your hospital in Abuja. Incredibly impressive that you have this real-time data coming from a hospital far away. And it's that relentless attention to the detail of counting things and watching the numbers and learning from the numbers, very important. And I think Aravind does that extremely well. Third lesson would be identify the big issues and the big leverage points, the big opportunities for change. Don't be so concerned about moving the deck chairs on the Titanic. Be more concerned about redirecting the Titanic so that it doesn't hit the iceberg. Look for big change. And fourthly, take bold action. And again, Aravind certainly does this. Grasp new ideas and implement them boldly. I've also learned, which I think is very relevant for the Aravind experience, that institutions really matter, and particularly the culture of institutions and the leadership of institutions. And I've been privileged in my career to have had institutional leadership positions at the London School of Hygiene and Tropical Medicine, at the World Bank, and at the Global Fund. And those experiences are absolutely as important as the detailed research work and the more scientific work that I've done. And what I've learned is that changing the world requires not just good people like you, but good people working in strong institutions like Aravind. And the culture of Aravind and the leadership at Aravind, combined with the good people who work for Aravind, are at the heart of the success of Aravind. And that's been very much an experience that I've gained in my various institutional leadership roles. So now I'm going to stop talking about me, and I'm going to talk about us. I'm going to talk about our species, Homo sapiens. And when we think of our species, the single most important piece of data, the single most important metric to describe the state of our species is the life expectancy at birth, what demographers call the E0, the life expectancy at birth, the single best measure of how well we're doing as a species. And up on the slide, you see some very interesting facts and figures. Our species is currently estimated to be about 300,000 years old. We've been on the planet for about 300,000 years. That estimate may change. They used to think 200,000 years. They now think 300,000 years. Current best estimate. And if we go back in time, 300,000 years ago, our life expectancy was about 30 years. That was our life expectancy. Come forward 200 years ago, 1820, our life expectancy had gone up very slightly. This is the life expectancy of everyone on the planet, not one particular country, all of us. And it had gone up to about 35 years. So not much had changed. And interestingly, I put in the BTW, the by the way, in my hometown of Liverpool in 1840, life expectancy was 27 years. So these very low life expectancies were not just a feature of tropical countries, they were a feature of Northern European countries as well, like my home. Come to 70 years ago, 1950, just after I was born, just after modern India was born, 1950, it had risen to 48 years, and today it's 72 years. And that's a quite remarkable journey, because if we look at the pace of change, there we go. Yeah. If we look, thank you. If we look at the rate of change from 300,000 years ago to 1950, life expectancy of our species increased by 18 years, which is 31 minutes per decade. Every decade, we live 31 minutes longer than the previous decade. But if you look at the period 1950 to 2020, the last 70 years, life expectancy has gone up by 24 years, which is 3.4 years per decade. So after a long, long period of very slow change, life expectancy has shot up in the last 70 years. In my lifetime, in India's lifetime, life expectancy has shot up for our species at this remarkable rate of 3.4 years per decade. Another way to put this is that life expectancy has increased more in the last 70 years than in the last 70,000 years. Remarkable. Or if I'm thinking in a Hindu or Buddhist frame, life expectancy has increased more in my current lifetime than in all my previous lifetimes. So where is this leading us? Well, at this rate of improvement, life expectancy for all of us on the planet will be 82 years by 2050. So the 100-year experience from 1950 from 1950 when it was 48 years through to 2050 when it will be 82 years. This will be a massive transition in life expectancy over a 100-year period. And we don't know, but 82 years may be approaching the limit. Now, if we all become cyborgs with much electronics and hardware built into us, then maybe life expectancy can go on up and up and up. But in our current biological reality, life expectancy cannot go on going up and up and up. And it may be that 82 years for the species as a whole is approaching the asymptote, approaching the limit of life expectancy. So that's a quite remarkable 100-year journey. A lot of it has already been achieved. The next 30 years, we'll see the rest of it happening. But what about fertility rates? Because the second most important metric to describe our species is how many children will be born to the average woman, the fertility rate. And if we go back to prehistoric times, we don't exactly know what the fertility rate was, but probably about 10. Probably about 10 children to the average woman, bearing in mind that many women would have died before the end of their reproductive lifespan, which tends to reduce the fertility rate. The fertility rate among women who live to the age of 40 would be a good deal higher than that. But let's say 10 as a good guess overall. In 1950, it had come down by half. It was 5. Today, it's 2.4. That's a remarkable reduction. And half of all countries in the world, there are 200 countries in the world, half of them, 100 countries today, have a fertility rate of less than 2.2. And 2.2 is a magic number, because 2.2 is the replacement rate. If your fertility rate is less than 2.2, in time your population will begin to decline. And if your fertility rate is more than 2.2, your population will go on rising and rising and rising. So already today, half of all countries in the world have fertility rates below replacement, and the rest are heading in that direction. By 2050, if you project that rate of change in fertility rate forward, the whole world may be at about 1.9, which means that once the momentum has got out of the system, the whole population of the planet will begin to decline. And that is very good news, because we're not going to deal with resource constraints and sustainability And we're not going to deal with climate change unless the total population of the planet begins to go down. And when the fertility rate for the whole of our species is 1.9, then in time, the population of the whole planet will go down. Now, coming back to today, for the world as a whole, fertility rate 2.4. Any guesses on what the highest rate in the world today might be and where it might be? Anyone like to guess? What might be the highest fertility rate of any country in the world today and where? Have a guess. In Africa? Yes, it is. 3 to 4, too low. Yeah, Africa, yes. Actually, West Africa, the country is Niger, and the fertility rate today in Niger is 7. So that is extremely high, extremely high. China today, 1.6, well below replacement. India today, anyone know? Fertility rate for the whole of India? Yes, 2.4, very close. Yes, thank you. Very important point. So India as a whole is 2.3. You said 2.4, 2.3. But that disguises tremendous differences among the states. So Tamil Nadu 1.7, you said, so already well below replacement. But of course, some of the northern states, Uttar Pradesh, Bihar, still high. Yeah, so tremendous differences in different parts of India. But India as a whole, 2.3, which is very close to replacement. So within a few years, India will be below replacement. Then the momentum has to work out of the system, and then the Indian population will begin to decline. Any guesses on the country with the lowest fertility rate? Which countries in the world are shrinking fastest? I heard Italy. Did I hear Italy? Yeah, Italy is one of them. Italy is down to 1.3, despite the Pope. The Pope is saying no birth control, but the Italians are saying, forget that, we're using birth control, we're down to 1.3. But there are 2 countries that are even lower than Italy. Right? Japan is low, but not the lowest, but you're in the right part of the world. Again, low, and you're in the right part of the world. Somebody said Finland. No. East Asia, the answer is Hong Kong, 1.1, and South Korea, 1.1. So those populations are going to decline steeply. That's a very low fertility rate. So what does all this mean? This means that our species is 2/3 of the way through a 100-year transformation, a century of transformation, starting in 1950, ending in 2050, transformation from a high mortality, high fertility species, which most mammals are. Most mammals are high mortality, high fertility. You have lots and lots of babies, most of them die, and you have the high mortality, high fertility reality for most mammals. We're transforming ourselves to be a low mortality, low fertility species. And mission accomplished, new species. Now, biologically, a very different species, not really a new species, but socially and culturally, undoubtedly a new species. A reality of low mortality, low fertility is socially and culturally a very different reality with huge implications for the organization of society, for the role of women particularly, and for the economy of human societies. So in a social and cultural sense, we will be a new species, and we're becoming a new species rapidly. Now, this is all happening in this 100 years. Out of the 300,000-year history of our species, it's happening now while we are on the planet. So we're spectators to and participants in this remarkable transformation of our species. I've seen this since 1947, when both India and I were born, modern India. And you in the audience will, I won't see the end of this, but many of you in the room will see the end of this. You'll be here working in 2050. I won't be, I don't think, but you will be. And you'll see the end of this transformation and be able to marvel at its impact on our species. But could this be interrupted? What I've described, is this safe? Is this secure? Is this bound to happen? Or is it threatened? And if it's threatened, what threatens it? Well, the answer is that 4 things threaten it. Nuclear war, which could wipe out our species entirely, or if not entirely, so substantially that we are really back to 100,000 years ago in terms of how we live and how we behave. An asteroid strike or a meteor strike, it wiped out the dinosaurs. It's quite capable of wiping out Homo sapiens. Climate change could easily have a huge impact on this transformation. And pandemics. And I'll say a quick word about each of these threats, but I'll say more about pandemics because we in the health sector, we as health professionals, pandemics is in our domain, in our professional interests, whereas nuclear war, asteroids, and climate change are maybe in the hands of other people more than our hands. So let's start looking quickly at nuclear war. You know, as I mentioned, it will be absolutely devastating. There's no such thing as a small nuclear war. The power of the warheads now is so large that you can't have a small nuclear war. The only nuclear war is a big global catastrophe. But don't worry. Rest assured, everything is okay. Relax. The prospects of this devastation happening are in the hands of 10 men. Women in the audience, please note, 10 men who are rational, peace-loving, in excellent mental health, so we can all sleep at night. So no worries there. Asteroid strikes. Again, not the business of health professionals, but as I said, they wiped out the dinosaurs, they can wipe out us. But again, don't worry. Hollywood has tackled this, and Bruce Willis is going to be sent up to land on the asteroid and to blow it up. So thank you, Bruce. We are sleeping easy because you're on the case. Climate change. Now, as we speak, the world is gathered in Madrid for the huge climate change conference, and it's incredibly serious. We're trying to keep temperature rise to below 1.5 and definitely to below 2 degrees above pre-industrial levels. We already have 1.1, 1.2 degrees above pre-industrial levels, and in many ways, it's too late. The chances that we can prevent a 3 or 4 degree centigrade rise above pre-industrial levels are now very, very low. So our challenge now is not to prevent climate change, it's to slow it, to prevent it getting to 4 and 5 degrees C above pre-industrial levels, but also to cope with the inevitable. And my personal view, and I'm not an expert on this, but my personal view, just to share with you how concerned I am, is that in my lifetime, I think the Greenland ice cap will vanish because I think the pace of change is accelerating. And I think I will live to see the vanishing of the Greenland ice cap, which amongst other things will put a large part of southern Bangladesh underwater and a large part of San Francisco, including our house, and many other places underwater. So this is incredibly serious. It has huge implications for our species, and it could certainly knock us off track in terms of that low mortality, low fertility transformation that I spoke about earlier. So we need to engage in climate change, and we need to elect politicians who take climate change very seriously. And a climate change denier has no place in the modern world of leadership and politics. So let's come to pandemics, which is in our domain as health professionals. And we'll spend a little more time on pandemics. And the first thing to say is it's all about flu. Don't think about Ebola. Don't think about Lassa. Don't think about chikungunya. Don't think about some exotic virus that may emerge in Africa. Flu, 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 and flu. The risk from pandemics is flu. And I'm going to tell you a tale of two viruses to illustrate why flu matters so much. I'm going to tell you about H1N1, and I'm going to tell you about H5N1. And then you'll see the point that I'm getting at. Let's start with H1N1 in April 2009. In April 2009, the Mexican government reported very promptly, to their great credit, a new flu strain, a new variety of H1N1, which was spreading rapidly in Mexico. And they alerted the world, and they immediately sent the virus to CDC Atlanta, who characterized the virus and shared it with other labs around the world, including in India. And then we were able to track what happened to this new H1N1 virus originating in Mexico. Number of countries, April 2009, 1. And when I show you these maps, a red country is a country that has laboratory confirmed H1N1 cases in the country at that time. So here we go. Week 1 week later, 11 countries, including most of North America and some parts of Europe. Week 2, up to 24 were attacking it. We had fever scanners at airports. We were trying to stop it. Could we stop it? You'll see. Week 2, 24 countries, most of Europe, all of North America, and there goes Colombia in South America. It's reached New Zealand somehow, and South Korea and Hong Kong. Hong Kong, you know, South Korea, as soon as it gets to San Francisco, it's just one flight away from Hong Kong, one flight away from South Korea. Incubation period is such that I get on the airplane without a fever, I get off the airplane without a fever, I go to my hotel, and then I start feeling lousy, and then I transmit it to other people who are attending the conference on influenza that I have just flown to Hong Kong to participate in. Week 3, we're up to 33 countries. Just 3 weeks after the first case, we're up to 33 countries, most of South America as well as North America, whole of Europe. China's now in the picture, Japan, parts of Southeast Asia. And you're all thinking, where's India coming? Where's India coming? And here it is, week 4, 41 countries, and it's got to India. And Indian labs are reporting it. And then you just keep going. Week 5, Russia. Week 6, we're into Africa now. Week 7, week 8, week 9, week 10, week 11, up to 135 countries, 181 countries. How many countries in the world? 200. We're up to 181. We're nearly in every country by week 21. And let's jump forward a year to March 2010. We're up to 214 countries. I just said there were 200 in the world. I was lying. There are more than that. There are obviously 214 countries in the world. It's everywhere. And if you see 1 or 2 countries in Africa that seem not to have it, the interpretation is they don't have the laboratory capacity to actually identify the flu strain. So they have it, but they can't prove they have it because they don't have the lab. So it's everywhere. So what do we learn from this experience? And by the way, the mortality was very low. There wasn't a lot of mortality. Not many people died. It was a mild flu. And there are 2 key properties of a flu virus. How fatal is it? What is the case fatality rate? The proportion of people infected who die. We call that the case fatality rate. How fatal is it? That's one key property. And the second key property is how transmissible is it? If I have it and I'm standing here and I cough a bit, how likely are you to have it? That's the transmissibility. And the message from H1N1 that I've just shown is mortality rate was low, very low, because tens of millions of people were infected around the world and very few died. But the transmissibility was extremely high. Otherwise, you wouldn't see this jumping around the world so quickly in almost every country in the first few weeks. So transmissibility very high, mortality low. Now let's come to another virus now. Let's come to H5N1. H5N1, not H1N1. A cousin, a closely related flu virus. First reported in 1997 in Hong Kong. You may remember Hong Kong had to kill all its chickens. There was this mass chicken kill in Hong Kong. And then reported from the countries listed at the dates listed. Last case reported from Nepal in 2019, close by. No cases reported from India so far. By up to now, 861 known cases in 18 countries, of whom more than half died. So what's our message here? Transmissibility, very, very low. Over a 22-year period, less than 1,000 people have been infected in less than 20 countries. Incredibly difficult to transmit. This is a chicken virus, this is a bird virus, and it doesn't transmit easily among humans. But my goodness, if it gets you, you're going to die, or you're very likely to die. 53% mortality rate, extremely high. Very few infectious diseases have a 53% mortality rate. So that's very fatal, but not transmissible. And the whole issue in pandemic flu is viruses are constantly reassorting genetically. So the flu virus is an avian virus. It lives in birds, particularly domestic poultry, chickens, ducks, and geese. These are kept in farmyards in Southeast China, and they cohabit with pigs. So you have a farmyard with domestic poultry who have these flu viruses and are constantly evolving them and having genetic reassortment and genetic adaptation. These bird viruses are infecting pigs. The body temperature of a pig is the same as the body temperature of a human. The body temperature of birds is different. But once it gets into pigs and adapts to pig body temperature, then it's very much infectious to humans because pig body temperature and human body temperature are the same. So in these farmyards in Southeast Asia, particularly in Southeast China, new flu viruses are constantly being made. And a day will come, certainly, we don't know when, but a day will come when we get a new flu virus that has both the properties. Highly transmissible, like H1N1, and highly fatal, like H5N1. And then we're in big trouble. Then that virus will be around the world in weeks. Estimates are that at least 200 million people will die. 200 million people will die, estimated, could be more. Economies will shut down. No one will go to work. And the loss economically will be trillions and trillions of dollars, and it will be a big catastrophe. And the race is on to try and stop that happening. But at the moment, we're completely vulnerable. We have nothing in place to prevent that catastrophe right now. Which leads to the question, are countries prepared to prevent this flu pandemic, to detect it if it begins to happen, and to respond to it effectively? And we now have some answers to that question, because just a few weeks ago, this report was published, the Index of Global Health Security, which looked at every country's ability to prevent, detect, and respond to a new infectious disease outbreak, including flu. And all countries in the world were ranked and scored by this Global Health Security Index. And surprisingly, in first place came the United States. This must be the only health metric with the United States in first place. On all other health metrics, the United States does very badly, but in this occasion, the United States does well. In 51st place came China with a score of 48. That really matters because China is where new flu viruses come from. Close behind, in 57th place, came India with an almost identical score of 47. And the runner-up, 195th, with a score of 16, was Equatorial Guinea. Now, we should take no comfort from this, because although that tells us the relative position of all the countries, we're ranking them, it doesn't really convey how well the high-ranking countries would do in practice. And about a year ago, we completed a big simulation exercise in San Francisco, simulating a flu pandemic with high transmissibility and high mortality. And that simulation exercise showed a disaster. We were totally overwhelmed in the first few days. We don't have the clinical facilities to cope with that number of cases of seriously ill patients who need to be on life support of various kinds. We would be totally overwhelmed. So we're in a race. We're in a race to discover a pangenotypic flu virus, flu vaccine, to discover a flu vaccine that can protect against all variants of flu. Big research enterprise at the moment, some encouraging leads, but nothing close yet. So that's a big research push. If we had a vaccine that could protect against all flu viruses, and if that vaccine was long-lasting in its efficacy, then we could try and vaccinate everyone in the world and therefore protect ourselves from this pandemic. There's also a race to discover more effective flu drugs, either prophylactic drugs that you can begin to take at the beginning of a pandemic, or curative drugs that can shorten the duration of infection and therefore make you less infectious for the people you come into contact with. So we're racing against time. Will we get the pandemic before we have the solutions? We don't know, but it's certainly a period of jeopardy and vulnerability. Now, when we look at this transition from high mortality, high fertility, to low mortality, low fertility, and we think how countries are doing, the Billion Persons Club, as Neelam calls it, becomes especially important. And the Billion Persons Club is a very exclusive club. It has only 2 members. A very, very exclusive club. And here they are, China and India. The next largest country in the world, which is the United States, is a quarter of the size. It's much smaller. It's a quarter of the size of either India or China. And half of all the countries in the world have less than 10 million citizens. That's like a tiny state in India, or even smaller than a tiny state in India. So most countries are small, and only 2 countries are really, really big. So what happens in China and what happens in India really matters, because global statistics are always dominated by China and India. If China and India are doing well on any global statistic, then the world is doing well. And if China and/or India are doing badly, then the world is doing badly. So let's take a quick look at this. These 2 members of this exclusive club, who, by the way, were identical. When modern India was born in 1947 and modern China was born in 1949, the 2 countries were essentially indistinguishable on social and health metrics. And indeed, up to 1990, they were very, very similar, because Mao Zedong's great leap forward and Cultural Revolution were in many ways a great leap backward, and social and health indicators either went backwards or didn't improve during that period. So any gaps now between China and India are in the last 30 years, really. They're a recent phenomenon. So let's look. Population 1.4, 1.4. And because India is growing much faster than China, in the next few years, India will become a considerably larger country than China. GDP per capita, big difference. China, much wealthier. Extreme poverty, big difference. China, much wealthier. Percent urban, big difference. China, much more urban. Life expectancy, big difference. 8 years, that's a very big difference. Maternal mortality rate, huge difference between India and China. completed lower secondary education, big difference between India and China. And I'd add one other statistic from my own recent work on malaria. If we look at malaria cases in 2018, last year, China has 0 and India had 10 million. So that's a big difference. Now I say this, obviously I am married to India, as you know, I am a friend of India. I say this because these things matter for India, for Indians, and for the world. If we're going to complete this transition to low fertility, low mortality, if we're going to achieve the Sustainable Development Goals, all countries that are lagging behind have to accelerate, have to do better. But India particularly has to accelerate and has to do better because the scale is so enormous. Now, as we said earlier, these numbers disguise huge diversity among states and between different parts of India. And one way that I like to think of this is that on the one hand, India's got to catch up with China, but on the other hand, Bihar has got to catch up with Tamil Nadu. So there's an external face to this, India catching up with China, but there's an internal face to this. If every Indian state did as well as Kerala, or did as well as Tamil Nadu, or did as well as Punjab, then India as a whole would be transformed. The states doing the best are doing so much better than the states doing the worst. So how to organize ourselves, again, as a species, as the inhabitants of our little planet, how to organize ourselves to achieve these big global goals, to deal with climate change, to deal with pandemics, and to complete this journey to low mortality and low fertility. So I'm going to present an extremely amateur view of human organization over the last 300,000 years. And any serious anthropologist or prehistorian would shoot me down in 10 seconds. But this is my very simplified view of things. From about 300,000 years ago to about 10,000 years ago, we were hunter-gatherers and we organized ourselves in bands. And from about 10,000 years ago to about 4,000 years ago, we began to build increasingly large agrarian societies, starting in the Fertile Crescent of the Middle East, and then in many other places around the world. And then for the last 4,000 years, roughly, we've had empires, starting with the early Middle Eastern empires, and then the Greek Empire and the Roman Empire, moving through to the empire of the children of Genghis Khan, which was the largest contiguous empire ever in the history of the world, through to the more recent empires, largely empires of European countries. And after the Second World War, interestingly, well over half of all the countries in the world were run by somebody else. It's very recent. In my lifetime, it's been the case that more than half of the countries in the world were colonies and were run by someone else a long way away. And then there was this surge of decolonization led by India and Pakistan in 1947, and then sweeping across the world to create a world, post-imperial world, with individual countries collaborating in the new world order of globalization and global institutions like the United Nations to try and create harmony and collective action among countries. But recently, that's been set backwards by the dramatic rise in strident nationalism. From the country where Neelam and I live, the United States, this whole Trump, let's build a wall around the country to protect it from all evil, and let's have this slogan, America First. That's the worst of all slogans, America First. It should be humankind first, not American first, because we're all in this together. Countries can't protect themselves from global warming. They can't protect themselves alone from pandemics. So strident nationalism is a really bad idea in relation to tackling the world's problems. And what we need to do is to finance and deliver global public goods, such as reversing climate change, preparing for pandemics, through international collective action. We need to come together as nations to solve problems collectively. If there was a government of the world, it's what we would ask it to do. There isn't a government of the world, so we have to create surrogates like the United Nations to enable us to work together on major collective challenges. Because at the end of the day, we all swim or we all sink. We're all in this together. There's no protecting my country and letting my neighbors sink. We're going to all sink or all swim, and hopefully we all swim. So I'm going to paraphrase John Donne here. No country is an island entire of itself. Therefore, never send to know for whom the bell tolls. It tolls for thee. And even more wisely, the words of Dr. V on this subject. Thank you all very much indeed.